Hi everyone, and welcome to Your Health Partner, brought to you by Lehigh Valley Hospital here in Hazleton. I'm Sam Lassant. You know, we learn a lot of great things that's happening in our health network today, but today we're going to learn about rehabilitation services at Lehigh Valley Hospital and also about their pharmacy services. We have a number of guests coming on, so we're going to get right to it. Joining me now is Melanie Sarno, who is a clinical staff pharmacist. Now, Melanie, we were talking about your grandfather, Phil. Before we get into the serious stuff, he was a great guy. Okay.
Thank you.
And for those of you who remember Phil Sarno, my friends, he was such a great asset to the area, as well as you are, right?
Thank you.
So tell me about you.
So I'm a clinical staff pharmacist with Lehigh Valley Hospital, Hazleton, and I primarily work in the outpatient pharmacy, which is a new service that we offer in this area. It's a retail pharmacy that's open to the public, colleagues, the community, and also the inpatients within the hospital. And we have a number of services that we'll talk about today.
Let's talk about some of the services. First, let's talk about in-house, in the hospital. Then we'll talk about how people in the area could take advantage of it as well.
So in-house, the hospital pharmacists educate patients on medication side effects and, make sure they know how to take their medication appropriately once they're discharged. In the outpatient pharmacy, we have a meds to beds program, which is an exciting new development for this area. It's been offered in other areas with Lehigh Valley for quite a while, and it's a great service.
What is it?
We deliver the patient's discharge medications right to the bedside. So they skip the step of having to stop at a pharmacy on the way home. They can get right to recovering at home. Their medicines go home with them.
Now, they need to have the prescriptions filled by a pharmacist, but they need the prescription, right?
Yes. So
how does that work?
The discharging doctor will send the prescriptions right to our outpatient pharmacy, and we'll fill them and deliver them to the bedside.
Now, all the patients know this.
We've been collaboratively working with nursing and the medical staff promoting the program, and it's really taken off.
Where is it located in the hospital?
The outpatient pharmacy is located on the campus of the hospital, behind the hospital in the annex building.
So this would be convenient for the patients who's there, and they could do their follow-ups there.
Sure, yeah, we deliver the medication right to the bedside, so they don't have to stop anywhere. They're taking the bag right from their bedside to their home, and if they would like to follow up and continue to get their medications filled with us after discharge, we're open to the public as well.
They get their refills if they need refills.
Yes, absolutely.
Okay. I think the basic thing here is the convenience factor.
Absolutely. They don't have to wait to get their medications filled. They know that if there's any issues with prescription coverage, we work directly with their care team to make sure that any adjustments can be made prior to them going home.
So now, what's a clinical staff pharmacist?
So we work collaboratively with the medical providers, the doctors, the nurse practitioners, and PAs.
Anyone in the area can come and get their prescriptions filled.
Yes.
Could they call could they have their doctors have them call the prescriptions, or how does that work?
Yes, so there's a number of ways doctors can send the prescriptions into the pharmacy these days. They can call it in, or they can e-prescribe it to Lehigh Valley Pharmacy Services, Hazleton.
Every time we do a show, I learn something new about what's going on.
Yeah, this service is going to be a great asset to the community. And not only do we offer competitive pricing, we're not driven by profit like most of the chain pharmacies. We're there to serve the community.
Anything else you'd like to tell us about your pharmacy department?
Just that we are open to the public, and we do have a wide selection of over-the-counter products. So not only can patients get their prescriptions at our pharmacy, they can get over-the-counter medications as well.
Well, I wish you the best.
Thank you very much.
Okay. My friends, is the Rehabilitation Services, the Station Circle, and of course, Wellness Center, also the main hospital. We have a team here talking about the Rehabilitation Services right after this break. Welcome back to Your Health Partner. I'm Sam Lassant. This is brought to you by Lehigh Valley Health Network. Remember, 24/7, you can watch all of our health shows, ssptv.com. My email, sam@ssptv.com. And thank you for making the Sam Lassant Show the #1 talk show in Northeastern Pennsylvania. You know, we service from north of Harrisburg all the way up to Clark Summit, and roughly about 250,000 households. We appreciate it. Over 60,000 of you are watching this show each week, and we really appreciate that. Now, we're bringing you up to date on rehabilitation services in Lehigh Valley Hospital, and also the pharmacy services. You heard from Melanie Sarno when we started. A lot of great things happening at the hospital. Joining me now, we have Ashley Dalberto, who is the Rehabilitation Manager. We have Christina Perry, who is the Rehabilitation Clinical Specialist. That's important. And Wayne Kogoy. And now you are the rehab operation team lead, right? Okay. Let me start with you, Ashley, because you are the manager. I mean, you're the big deal here. Okay. Tell me about yourself.
Yeah, so I've been with Lehigh Valley about 11 years now. I'm a physical therapist by trade, so went to schooling about 6.5 years with Misericordia University, came on as a staff therapist, and slowly over the last about 4 years have transitioned into the manager role, overseeing Hazleton Health and Wellness Center, Station Circle, Hazleton Peds, and Mountaintop Clinics.
So tell me, what do you like about your job?
Flexibility. We interact with people all day long, so you get great conversation going. You get to help people achieve their goals, whether it be getting back to just sports, mobilizing around your home, whatever it might be, you get to see them achieve those outcomes.
Tell me about the services you offer at Station Circle.
Station Circle is primarily our orthopedic site. We have doctors on the other side. We have Dr. Portanova in podiatry. We have our occupational medicine department there. We have Dr. Falvello with orthopedics. So Christina, Wayne, and the team over there, they focus primarily on any kind of musculoskeletal injury from head to toe.
Tell me about your team now. This is, this is the important part, working together.
Yeah, we have Christina, who recently just completed a year-long residency with our orthopedic specialty group. So she is board certified in orthopedics. So she's got more advanced knowledge, a little bit more in-depth knowledge than a regular staff therapist. We have Wayne, who specializes with spine. He's got some extra certifications with that. We also have another physical therapist on site that splits her time between Station Circle and the Wellness Center. She does general musculoskeletal orthopedics, and then we have some physical therapy assistants that follow out the plan of cares that the therapist create for each individual person.
As a team, sometimes do you work together like on a certain patient? When
yeah, absolutely. We're always collaborating. There's certain things that Christina or Wayne might jump in and do during treatment that the physical therapy assistants might ask them to take a look at or just do some hands-on techniques. So they use their advanced knowledge in those areas, but we definitely collaborate all day long.
Now, I know we have the rehabilitative services in different locations, okay? How do you know what location you go to?
Generally, it's a geographic based on your home location or your preference, whether you're getting out of work and coming to therapy or going to therapy and to work. So most of it is going to be based on personal preference. But if it's something specific, if you have a spine issue and you want to make sure that you're with Wayne for that formal treatment, we'll get you at that location. So the doctor might indicate that on the script.
So you know specifically what that person needs, and then you'll direct them to different areas. But you're mostly at the Wellness Center, and then you travel?
Yes, so I treat out of the Wellness Center, but then I also visit other sites, help them as needed, whatever they might need.
What's the most common rehabilitation that people are going?
I would probably say general low back, neck pain, shoulder pain, just your general aches.
Christina, so you're a Rehabilitation Clinical Specialist. Tell me about some of the latest techniques that you offer and how they benefit the patients.
So some of the cool tools or technology that we have over at Station Circle, we have an anti-gravity treadmill.
What's that?
So the anti-gravity treadmill is similar to being in a pool, is how we'll describe it to patients. You wear a special pair of shorts, which I actually have here with me today. And
you don't want me to try them on, do you?
You could if you'd like.
That's okay.
So you'll wear these special pair of shorts.
Why
and
is
you'll
that?
zipper in.
Looks like a space off.
Yeah, and actually the AlterG has NASA technology in it.
Is that
so
right?
It
See
does.
how smart I am.
You'll wear these shorts inside the treadmill. It's just a normal
What do you mean
treadmill
inside
underneath.
the treadmill? Don't you stand on this treadmill?
You do. You stand on top of it, but around you, you're surrounded by sort of a cockpit that you'll be zippered into, and then it inflates with air and helps to off-weight your body. With the technology, it actually helps to lift you up a little bit. It could take up to 80% of your body weight away to allow you to walk or run or even do exercises inside this treadmill. It's great for people, especially with joint pains or after surgeries, if they have any restrictions, to allow them to be able to walk or do any kind of activity under those restrictions and take weight off of your joints.
So give me an example of a person who would need that or who that would benefit.
We use it a lot for any joint replacements, that ankle, hip, knee, or even ACL surgeries when they're relearning their patterns to walk or to even get back into running. It allows you to be able to go through those motions but not put as much stress through your joints.
Will that speed up the rehabilitation process for a person?
It could definitely help to promote the healing and yes,
yeah.
It could.
And so it elevates your weight.
Think about being in a pool. So when you submerge yourself in the water, you feel a little bit lighter, right? So the treadmill does the same thing. When the air inflates, it could take up to 80% of your body weight away.
Now the treadmill's there.
There is a treadmill.
It's the shorts and the thing you get into this cockpit, right?
Yes.
I'm claustrophobic.
Okay.
Okay, so will that affect me?
No, it should not, because your body, the top half of your body is completely outside of it. Yep. So it's just from the waist down that you're zippered into it.
And so you're walking on this treadmill, but you feel you're 80% lighter.
It could be up to 80%.
Yeah. And that's more of a benefit for the healing process?
It could help to restore your natural walking patterns, right? So where people have a lot of pain walking under 100% of gravity, we could take some of your weight away and take some of that pain away in your joints to allow you to walk normally.
You wonder how they come up with this stuff.
NASA.
Yeah, and they took that from NASA, yeah. And how long have you been doing this?
It'll be 5 years in January.
Now you also have a blood flow restriction.
We do.
Okay, what's that? You brought something here?
I did. So we also have blood flow restriction, which is similar to wearing a blood pressure cuff, either on your leg or on your arm. And it temporarily restricts some of the blood flow to your muscles, which helps to promote use of that muscle. So it makes it work harder under those conditions.
I thought you wanted blood flow to go to these areas.
You do. To temporarily restrict blood flow to your muscles makes them recruit more of that muscle and work extra hard. So it basically tricks your body into thinking that you're working super hard when you're just doing normal exercises. So
you wear this when you're doing your exercise?
Yes.
And it restricts the blood flow to any part of the body, or?
Yes. So if you're going to do it anywhere for the shoulder down, you would anchor it onto your arm at its highest point. Or if you're going to do it anywhere from the leg down, you would anchor it and support it right on the top of your thigh. What have you found by people using that? So when we use these cuffs, it helps people to get a little bit stronger, a little quicker. And it helps the muscle to use as much as it can in order to promote that tissue growth. Who would be a candidate for that? We've used these a lot with those who've gotten ACL repairs, so a knee surgery, but I've also used it with patients who were recovering from a shoulder surgery as well. There's so many great things happening that we have available to us, you know, that people just don't know about. That's why I'm glad we have these shows to inform them, you know. Anything else you'd like to tell us about your area? I think we have a great team where we're at, and everybody is, you know, very well connected. We all collaborate, just like Ashley mentioned earlier. And I think that we offer a lot of special services just throughout the network in the area. Wayne, tell us about what you do. You're a rehab operation team lead.
Yep, so I'm just one of the PTs over at the Station Circle there. Just like Ashley said, we oversee the different clinics between the Health and Wellness Center, Station Circle, and Mountaintop.
So now we're talking about shockwave therapy. Mm-hmm. That scares me.
Right.
When I hear shock.
So people get real nervous when they hear that, and they think.
So make me feel calm about it.
Right. So first, it's actually not electrical whatsoever. So the shock wave, you know, people think electrical current, but it's actually sound waves. So you have an aperture, a gun that delivers these sound waves, and so whatever you're treating, whether it's Achilles tendonitis, gluteal tendonitis, calcification, whatever injury you're treating, you get this aperture, and there's different sound heads that go on this machine. And you go to wherever the injury or soreness is, and you turn the machine on, and there's a little bullet inside this gun that strikes the sound head. And when it strikes that sound head, it sends sound pulses into that joint. So it is a little bit of a noxious stimuli. It's a little uncomfortable, but the sound heads, there's, I think, 10 or 12 different sound heads you could use, so one will be comfortable for the patient.
Now, my friends, if you know, we're talking about all this great stuff we have, you know, I guess you got to go to your family doctor, right? So if you're experiencing any difficulty, you know, like you're saying, a joint pain or whatever. So give me the areas that someone's out there, if they have these concerns, what would be the areas of concern that someone would say, look, let me call my family doctor, get up to the rehab services that Lehigh Valley has to offer?
A lot of times it's people who have, say, plantar fasciitis for a long time, and they've done stretching and they've done conservative approaches, or even shoulder tendonitis and calcification. If those injuries are just nagging and they've tried every other approach, but it's still kind of there and still annoying them a little bit, they could just contact their doctor and say, hey, you know, I heard that they have this other type of treatment, shockwave therapy. It's non-invasive. Could I give it a go? And they could contact their doctor, and they could just get a referral from any doctor.
You know, it reminds me, there's so many people out there suffering from different things, and we have the availabilities available to them, just that they don't know that they're available. You're at you have the Health and Wellness Center, and you have the Health Center Mountaintop.
Yeah, okay. Station Circle. Yeah.
And of course, Station Circle were actually explained. But what are some, you know, some of the things that you would tell our viewers if they have different aches and pains? What would they be? Christina, actually jump in here.
Yeah, so not even just aches and pains. If you have any sort of imbalance, if you just don't feel steady on your feet, if you have a fear of falling, if you have dizziness, sometimes we can even help with like post-concussion, chronic headaches, things like that. So it's not just aches and pains, but a lot of other stuff too. We have a lot of services in all of our clinics that we're able to help the community.
Well, that's it was very informative today. Thanks for coming on. Okay,
absolutely.
Christina, nice to meet you. Nice to see you again.
Yeah,
you're becoming a regular on my show. You're co-hosting. Your health partner, my friend, brought to you by Lehigh Valley Health Network. The phone number is on the screen. You saw some of the areas at the location, Station Circle. But you have any of these pains, give your doctor a call. Go get better. We'll see you next time.